Local Justice, presented by Elrod Bobe Law Firm, serving our community since 1980. Here's your host, Attorney Ben Leader.
Welcome to Local Justice. I'm Attorney Ben Leader, and today I'm honored to have with us a very special guest to talk about a cause that's very near and dear to my heart and very important to this community. Pleased to welcome Jennifer Graham, the CEO and Executive Director of Hospice and Community Care in Rock Hill. Jennifer, thanks so much for joining us on the show.
Thank you.
We got a lot to talk about, but I wanted to start out by just telling a little bit about our connection. And this cause is extremely personal to me. My dad passed away last August and was part of a group more than 40 years ago that got together and decided to help start this organization that is now known as Hospice and Community Care. And he did so after watching his mom spend her final stages of life in a hospital and surrounded by machines and felt the void missing of comfort and peace and dignity. And I think him and a group of other community members just felt like this community deserved something better, and that's what got the conversation started and ultimately helped get the organization off the ground. And in a full circle moment, this organization provided end-of-life care for him last fall and took great care of our family, and you were an integral part of that and played a big role in making sure that we got the same experience that everybody else has used hospice and community care over the last 40 years has received. And so I know that anybody who has been through this has been personally impacted and knows the importance of it, but I really wanted to take some time today to let us educate the folks that may not be as familiar with you and the organization and what y'all do. So thank you for joining us.
Thank you for having me.
To start out, I want the viewers to get to know Jennifer a little bit better. Please tell us a little bit about your background, where you grew up, and what ultimately attracted you or led you to the role of hospice.
So I didn't grow up in this community, but I've been a part of this community for almost 30 years now. I grew up in a small town, and so Rock Hill really kind of reflects the small town values that I had growing up. I did attend college in the state of South Carolina and then moved to Rock Hill, where I've put down roots for the past 30 years. My kids have grown up here, and I've actually worked for Hospice and Community Care for 25 years.
Wow. And the organization's changed a lot over that 25 years. The landscape of hospice care in general has changed a lot over the course of that 25 years, but you've been along the journey the whole way and really helped adapt and pivot as needed to make sure the organization continues.
It has changed in a lot of ways, but then in many ways it's still the same organization that your dad and a group of community members started in the early 80s. The basic premise was that everybody deserves dignity, compassion at the end of life, and our community is about serving each other. And so those roots remain clear today as they were in 1985 when we took our first patient.
That's great. The mission still rings very true today, and I know that the word hospice brings with it a connotation for a lot of people, and they assume that it only means one thing, and most people don't realize that all hospice organizations are not the same. They're not structured the same, and our organization here in particular is unique, and it's hospice and community care. It's not just hospice. And tell us a little bit about the misconceptions of hospice and also touch on the community care aspect that I think most people may not be aware of.
Sure. I think there is that connotation that when you hear someone is under hospice care, you think the last days of life. What we are really focused on is when a disease process has reached the point where curative treatments are more harmful than helpful, that we can step in and help navigate those last stages of a disease process. And that can be a few days, a few weeks, a few months, and sometimes a few years. It's when the patient and the family decides that they want comfort treatment, that they want to palliate or alleviate some of the symptoms that are there, help manage the pain, and then also address the social and emotional aspects of having a serious illness. And with the family especially, I think so much of medical care is focused on the patient and the disease process. What we do is very different because it is focusing on not just the patient, but the family unit as a whole. Certainly, palliative care is kind of a popular word now, and what hospice does is palliative care. Palliative care is just palliation of pain and symptoms. Palliative care is a different type of medicine. For some people, they can still seek treatment for disease process. And then you talk about the community care aspect of that. I think when we first started this organization, when they started it in the 1980s, it was York County Hospice. That's what they thought they would do, is provide hospice care to York County. And what they found over the years is that that grew into the larger community of not just York County, but now we serve York, Chester, Lancaster, Fairfield, Cherokee, and Union counties. Wow. And so we expanded the hospice services, but we also expanded how we reach out into the community to provide support, how we provide education. And we have a number of programs that reach out into the community that have really nothing to do with hospice care, but everything to do about the community and how we care for the greater community.
That's great. And I know one of those things is the caring closet, which is a huge benefit to the community, and it's something that people take advantage of all the time. Tell us a little bit about what the caring closet is.
So the caring closet it was born out of just a random idea a few years ago, where we were getting medical supplies in after patients passed away, or we were getting medical supplies in after somebody had a knee replacement, shoulder surgery, something like that, and they had those walkers left over or a brace left over. And we decided, could we give this back to the community? Could we serve others and kind of pay it forward? And so the caring closet is a medical lending closet that is open to anyone in the community. They don't have to be under hospice care at all, to come and receive free durable medical equipment and medical supplies that others have donated. And so we have hundreds of people that are served each month through the caring closet, and that is just an extension of the missional aspect of the organization.
That is so powerful, and I know personally that's not something that results in any profit or revenue, quite the opposite, I'm sure, yeah. But it's still such a great service, and I think it's so powerful that the families who have gone through hospice that y'all have helped care for feel so compassionate about giving back and giving the equipment and letting that be put to use for other families. So I think that's a great thing.
And it's all volunteer driven. I think when your dad and the group of community members started this, they weren't getting paid for this. They never got paid for it. It was about serving the community and having volunteers that would step in and say, I have this skill and I would like to lend it to serve the people that I live and work with. And that is still true today. The Caring Closet is all volunteers that show up each week to serve the community. And in addition to that, we have volunteers throughout other missional aspects of our organization, like the resale shop, and then of course patient-facing volunteers that go out and provide support to patients and their families.
It really is a community effort all around. So thank you for sharing that information. We're going to take a quick break from our sponsors, and when we return, I want to talk a little bit more about the landscape that end-of-life care right now in general across the state and country is seeing, and some of the changes taking place. And so look forward to continuing the conversation with Jennifer Graham. And to the viewers, thank you for tuning in to another episode of Local Justice. We'll be right back here shortly. After a car accident, everything feels overwhelming. Your injuries, your job, the insurance companies contacting you before you even understand what happened. And you deserve someone who knows how to navigate these situations. A law firm who has handled thousands of injury cases across our region. Elrod Pope has been helping injured people for more than 45 years. If you have been hurt, call Elrod Pope. We will help you get back on your feet.
We know the type. You like to start early, finish late, make lemon squares, and make payments to the college fund from anywhere in the house. We know you rely on Comporium for the things you rely on most, like a view of the backyard. That's just a bunny, and hundreds of channels to watch, whenever you want. So you may think of us as just your internet company, but we're more like the I didn't know they could do all that company. Comporium, always ready.
Coke Zero is now Coke Zero Sugar, with great Coke taste. Some people were excited to hear the news, some were skeptical. So we're not gonna have the star of the show you're watching come out and say, you'll love it. No special jingle written by this week's hottest pop star. No famous internet celebs who happen to be holding the label just so. Okay, maybe just one little pour shot. The only thing that will make you believe Coke Zero Sugar has great Coke taste is trying it yourself. Ice cold Coke Zero Sugar. Try one today.
Being there for someone in their time of need is what Green Funeral Home has done compassionately for 4 generations. It's a privilege we take very seriously.
We believe each life should be honored and remembered by family and friends. Whether you choose traditional burial in our chapel or another venue, or cremation provided by our on-site crematory, we will help guide you through each step to ensure your needs are met.
We are also available to discuss pre-planning. Peace of mind that you have helped your loved one by making those difficult decisions.
When the need arises, our family is here for your family.
When a bank gets a new customer, they email a bunch of links and say good luck. But that's not us. A community banker sees this as a start of a new relationship, so we come to your office and bring a team of business specialists. Then we train your staff in all the tools they need to be successful. Bottom line, a community banker is in the trenches with your business every step of the way. I'm Catherine Faircloth, and I'd love to be your first community banker.
Live Strong at the YMCA is a lifesaver for so many people.
I love Live Strong because you meet so many people, you learn how strong you can be physically and mentally.
The camaraderie and the closeness that you feel and come together as a group is just amazing.
We meet them where they are and we work with them to help them get stronger.
At the YMCA of Upper Palmetto, we are proud to offer our community the support of the Live Strong program to all cancer survivors. For more information, visit your local branch.
Welcome back to Local Justice. I'm attorney Ben Leader with the Elrod Pope Law Firm, and today I'm honored to have with us the CEO of Hospice and Community Care, Jennifer Graham. Jennifer, thank you so much for joining us.
Thank you.
Really enjoy the opportunity to be able to educate the viewers a little bit more about the organization and the critical work that y'all do for us in the community. And one of the things I want to touch on is the landscape of hospice care in general. And you know, I'm familiar with kind of some of the challenges that are going on by virtue of being a board member, but I don't think the community as a whole may realize what's taking place in terms of private equity being involved and a lot of independent, locally run hospice organizations ceasing to exist in a lot of areas. And I really want the viewers to understand how fortunate we are, how blessed we are, and how rare and unique it is to have an independent local organization like hospice that's run by people that live here, that care about the people in the community, and that choose to spend their careers here, and why that's different than some of the organizations we are seeing in other areas of the state and country.
Right. Healthcare is in a weird place right now in this country, and I think you have an older segment of a generation that's aging into a system that wasn't really built for them. So when our organization started 41 years ago, hospice was a rogue kind of outsider to healthcare. It was really volunteer-driven, volunteer-led, was not reimbursed by Medicare. And so it was free care that was being done in the community after everything had been exhausted. Over the past 40 years, hospice has really become mainstreamed into healthcare and a part of the continuum of care that's offered to patients and families that have serious illnesses. What has happened with that is that it is monetized, and you see a lot of mergers, a lot of acquisitions that are happening in this space because it is reimbursed by Medicare, and there's some reimbursement advantages if you can cost save for a patient and a family and the money that you're spending on them. So we are unique because the decisions that we are making are not driven by cost savings, they're not driven by shareholders, they're not driven by a need to merge or be acquired, but they're driven by the needs of the community. And I think that is incredibly important because we're going to look at staffing based on what a patient and family needs. We're going to look at medications and other interventions based on what the patient and family needs, not what is going to give us the highest rate of return, not what is going to save us the most money. And I think the best example of that for our organization and for the community that we serve is the Wayne T. Patrick Hospice House. That was not guided by reimbursement from Medicare or any government funding. That it exists purely because the people of this community about 20 years ago said, we want that for the people who live and work here, who need a little bit higher level of care and don't want to end up in the hospital in their last days of life.
Absolutely. I could not have said it better myself. And, you know, I think the fact that people like you in this community are involved in running this organization and in the best interest of these families is really the heart of every decision. And, the decisions are being made in families' living rooms and not in boardrooms, and the duties are to the families and not to investors, and that's special, and that's preserving something special, and that's not the case everywhere. Tell us a little bit about what you're seeing, on the national scene, or the trends you're seeing, or a lot of organizations like ours, having to sell to private equity and to merge with private equity in order to continue to survive.
So in the mid-'80s when we started, every community, every county had their hospice organization that was started very similar to what we started here in this community. And then over the years, they may have combined and served maybe a little bit larger community area. Now in South Carolina, you do not see independent, freestanding, not-for-profit hospices in the landscape. There is only a handful of us that exist. And because it is hard to provide all of the services that we are required to provide by Medicare and serve our community the way that we think they deserve to be served. And so we certainly depend on the community to help fund a lot of the extra programs that are there and bridge the gap, because one of the beliefs that we have in our organization, and I know you know this well, is that everybody deserves access to comfort and dignity at the end of life. And so we are going to serve people regardless of their ability to pay, regardless of what their insurance is going to reimburse us, because that's the mission of who we are. I think the state of South Carolina, the county of York County, or any of the other counties in South Carolina, miss out on that when they don't have a local hospice serving them. And we want to make sure that we remain accessible, and it really is unique in this healthcare setting now.
And the challenges, the cost involved in operating in today's world and the climate we're in now is harder than ever. I mean, in simplest terms, the math just doesn't math a lot of times. And so it really does require the community to step up. And for 40 plus years, it's been a great joint effort where community members and organizations and foundations have stepped up to preserve this organization and make sure it continues to exist. And I would really lean into challenging the viewers to continue to do that and to step up. And it's more important now than ever, and the need's more important now than ever to do so.
It is. Thank you for saying that.
Absolutely. We're going to take another quick break from our sponsors, and when we return, we'll finish up our final segment and talk a little bit more about the future of hospice and the peace and dignity aspect of it that is so critical and so important. So thank you for your time, and thank you to the viewers for tuning in. We'll be right back with more Local Justice with Jennifer Graham here shortly. I wish everyone came with a warning label, because if you could predict a car accident, you would probably stay home that day. But accidents are never planned, and the moments after are confusing. You don't need a warning label. You need a law firm who knows how to handle this. A law firm who has helped people in South Carolina through injury cases for decades. If you've been hurt, call Elrod Pope. We'll help you understand your options and get moving in the right direction.
Coke Zero is now Coke Zero Sugar, with great Coke taste. Some people were excited to hear the news, some were skeptical. So we're not going to have the star of the show you're watching come out and say, "You'll love it." No special jingle written by this week's hottest pop star. No famous internet celebs who happen to be holding the label just so. Okay, maybe just one little pour shot. The only thing that will make you believe Coke Zero Sugar has great Coke taste is trying it yourself. Ice cold Coke Zero Sugar. Try one today.
When a catastrophe hits, it can be a very stressful time for you. When you have trees on your house, when you have trees on your cars, and you don't know what to do, you call us.
We're not a 1-800 number, we're an 803 number. We've been in business for over 60 years because we take care of our clients. That means taking care of them during claim situations.
We're not 9 to 5, we're 24/7. We're gonna be there when you need us most. Gill Insurance, your local auto owner's agent. Understanding business is how we do business.
When it comes to prescription medications and health needs, Rock Hill residents have been turning to Good Pharmacy for over 50 years.
I've been coming to Good Pharmacy since we came to Rock Hill in 1984, and I would not change pharmacists for anything.
With their knowledgeable staff, you can always trust that your prescription will be filled with complete confidence and care for your health. Good Pharmacy, conveniently located at the corner of Ebenezer Road and Camden Avenue.
Founders Federal Credit Union means banking made for you. The on the go, the pick up and go, and the "oh, I want to go." Because at Founders, we give you the financial tools that make every dollar work for you. For the little things to the big things. For your future and your peace of mind. We'll always stay grounded in our roots, but reaching beyond what you'd expect is where we'll always go. Find out what our members already know and enjoy a new way to bank. Relax, you're with Founders.
Welcome back to Local Justice. I'm Ben Leader, and today I'm joined with the CEO of Hospice and Community Care, Jennifer Graham. Jennifer, thank you so much for generously sharing your time with us this morning.
Thank you for having me.
Absolutely. We've talked a lot about peace and dignity and comfort, and that's really what comes to mind for me when I think of hospice and community care. And I think of my dad's final months where he was receiving in-home hospice care, and he was able to stay in his favorite chair and watch his favorite golf tournaments on TV. And we were able to spend real time with him while your team was able to worry about everything else and help guide us. And we were able to laugh with him, to share stories with him, to tell him everything we wanted to hear. And that time was so special. And I think your team was really the reason that we were able to have that time. Otherwise, we would have been trying to do all these things ourselves. And so I want to touch on a little bit about the team, because I think that's one of the most impressive accolades of your organization and the work they do. And it's not easy work. It's not easy to find people willing to devote that much of their life towards very heavy stuff every single day. Tell us a little bit about the team and the role they play.
The people who work for our organization are absolutely amazing. My job as CEO, your job as a board member, is to seek the resources so that they can do their job well. And they are highly skilled professionals. They have a heart for what they are doing. They could go and get a job in healthcare anywhere. And they choose to be here with patients and families, providing that support and education at the end of life. I think one of the things we talk about with our staff is that the hospice benefit was never created for us to provide all the care. The hospice benefit was created to provide support and education to families so that you could be a part of those final weeks, months. And that's what we do every day, is going into homes to make sure that our families are understanding how they can best care for their patient, what the process may look like, how we provide them support on the hard days. And we do the same thing at the hospice house in providing families a place to come and receive rest, so that they can show up as that son or daughter or spouse in those final days. And our team is why we exist. It is the heart of what we do, and I'm so proud to work alongside them.
Well, kudos to you for having the team you have in place and the incredible work that they do. The hospice house in general is a remarkable facility. Everything that I hear bad about hospitals, I think of the total opposite when I think of the hospice house, how quiet it is, how peaceful it is, the porches on each room. I mean, it really is a really special facility, and again, something very unique that a lot of places and communities don't have.
We are so fortunate that we have that to offer to the community. We often hear from families when they've reached the point where they are coming into the hospice house. Most of the time they have spent days, if not weeks, in the hospital. They're exhausted emotionally, they're exhausted physically, and they often tell us the minute they walk in the door, they feel like they can take a breath. And that's such a gift that we can offer to them in those final days.
Absolutely. And we've talked a lot about the community effort it takes to keep this going. It's y'all do everything you possibly can and do it very well, but it's not enough. The community has to step up and be a part of this too. Obviously, donations are a big part of it. Financial contributions are a big part of allowing y'all to continue to do the work that you do. But it doesn't have to necessarily be, big checks or big numbers. Every dollar that's given helps, and even $1,000 may allow 5 more people to have wheelchairs or whatever it may be. It's every little bit helps. So whether big or small, I think donations are something that are critical to the survival. Is that fair?
It is fair. I think we joke that we exist because people have written us small little checks for 40 years. And so we have donors that just write us that monthly check, and it's $25 every month, but we can count on that. I think we also have some really unique ways that you can give back without pulling out a checkbook. And so sometimes people are in different situations. But we have the resale shops. We have one in Lancaster and one in Rock Hill. That's a great way to give back to the organization. We take those donated items, turn around and sell them to the community, and then all of those proceeds go back into the organization so that we can care for the people that are under our care.
That's great, and from an individual standpoint, that's a great way to be able to volunteer, come spend some hours at the thrift shop or the caring closet and help with the equipment. From a business standpoint too, I think it's a great opportunity if a business is interested in having their employees, have a service day. A great way to do that is to have them set up to volunteer for a few hours at one of those, options.
If a business wants to have a service day, we will figure out a way to engage them because there are so many needs that are on our campus. And it's a great opportunity for us to get to know the people of the community, what the needs are out there so that we can create more programs to help serve the needs that are in our community.
And if somebody was interested, whether individually or from a business standpoint in helping, whether it's contributions or giving their time and volunteer efforts, what is the best way for them to go about doing that, or who should they get in touch with?
So they can call our main number, which is 803-329-1500. They can email us at info@hospicecommunitycare.org, or they can visit our website, which is hospicecommunitycare.org.
That's great. Well, thank you for that. And my ultimate goal in having you on the show is that some of the viewers out there who have not had to personally walk through the doors at the Wayne T. Patrick Hospice House can still see the benefit of this organization and can feel passionate and compelled to step up and help preserve its future. So thank you for sharing your time and your insights on the great work y'all do. And here's to another 40 plus years of hospice continuing to support this community.
Thank you, Ben.
Thank you. And thank you to the viewers for tuning in to another episode of Local Justice. We talk a lot about justice on this show, and hospice care is about dignity, it's about compassion, it's about helping families navigate one of life's most difficult circumstances with grace and with support. And so justice is not just in a courtroom, it's not just involving a lawsuit. It really is, part of every phase of life, and there's nothing more important than the most vulnerable end of stage of life. And so thank you to Hospice and Community Care for doing the great work they do in this community. Thank you to the viewers for tuning in to another episode of Local Justice. We'll see you next week. Stay safe out there. So when a client first comes into our office, they're dealing with very painful injuries. They're trying to provide for their families at the same time. You can just see the sense of anxiety, the grief, the worry on their face as soon as they walk in the door. One of the first things we do is we try to alleviate that concern and take that weight off their shoulder and put it on our plate. We see people immediately leave here from the first consultation. I can already see a sense of relief because they know that they've got a team helping them now and it's no longer just their problem.
Watch out, Doc.
It's the 42nd Great Easter Egg Classic, Thursday, April 2nd.
It's free.
Cherry Park gates open at 2. The first of 10 exciting runs starts at 3 p.m. with 30,000 eggs and 2,000 prizes.
And meet my friend Bo Bunny.
Presented by Rock Hill PRT, the YMCA of Upper Palmetto, and your favorite OTS media stations. Go to EasterEggClassic.com for all the details. The Great Easter Egg Classic,
where every bunny is a star.
We know the type. You like to start early, finish late, make lemon squares, and make payments to the college fund from anywhere in the house. We know you rely on Comporium for the things you rely on most, like a view of the backyard. That's just a bunny, and hundreds of channels to watch, whenever you want. So you may think of us as just your internet company, but we're more like the I didn't know they could do all that company. Comporium, always ready.
From my first watch I purchased as a teenager, which still runs today, to the diamond ring I surprised my wife with, which she still talks about today. A gift from Norman Hagee is as good as it gets. Whether it's elegant timepieces by Bulova, Caravel, and Bel Air, or ornamental ironwork-inspired Southern Gates collection, or dazzling fine jewelry. A gift from Hagee is backed by over 60 years of family-owned and operated experience. Norman Hagee Jewelers, for gifts as good as it gets.
Live Strong at the YMCA is a lifesaver for so many people.
I love Live Strong because you meet so many people, you learn how strong you can be physically and mentally.
The camaraderie and the closeness that you feel and come together as a group is just amazing.
We meet them where they are, and we work with them to help them get stronger.
At the YMCA of Upper Palmetto, we are proud to offer our community the support of the Live Strong program to all cancer survivors. For more information, visit your local branch.